everyone, I'm State Representative Jillian Gilchrest. Welcome to another episode of Advocacy for the 18th. I am joined today by Sarah Croucher, who is the Executive Director of NARAL Pro-Choice Connecticut, which holds a special place in my heart because I once was the Executive Director myself. Sarah, thank you for being here.
Thank you so much for having me here, Jillian.
And can you please tell us what is on the agenda for the pro-choice community this legislative session?
So we have a number of bills that we're looking at that form part of a set of bills that are under the umbrella of something called the Connecticut Coalition for Choice. And so that's a group of organizations, as I think you know, that are committed to moving forward proactive policies around what we call reproductive freedom. So that means abortion rights, obviously, which for us at NARAL are really important. We want to make sure, especially in this current political climate, that people continue to have access to abortion. And that means not just that basic legal right to abortion, but really the ability that when they need and want to access an abortion, to actually be able to go and get that procedure. But that also means that we look at a full spectrum of reproductive rights. So from birth control access, through abortion, sexual health education, and then also the ability to support people when they're parenting. And so that means that we have a broad agenda, we're really excited about it, and we think that Connecticut is going to be really moving the nation forward in terms of these policies this year.
Fantastic. So can you get a little more into the weeds? What are some of the bills that we'll see this legislative session?
So one bill that we just had a public hearing for on Monday night is about what we call fake women's health centers, because it's a pretty clear descriptor of what they do. They are centers that are set up to try and mimic regular reproductive healthcare clinics, but in actual fact they are anti-abortion organizations, and they advertise often to people, not always, but the problematic ones advertise to people as though they offer abortion services when in fact they don't. And so what happens is someone Googles abortion help Connecticut and can end up at one of these centers because it says to them, thinking about abortion, we're your first stop. And what we want to do is just make sure that that kind of advertising, which suggests to people that these centers are somewhere they can go when they are looking for an abortion, that we eliminate that kind of deceptive advertising. So it's a very narrow bill.
Fantastic.
It's one that's very specifically targeted on advertising, and we're really hopeful about getting that through this year.
Great, and I am a co-sponsor on that bill.
Yes, you are. I think probably on all of our bills.
Yes.
And then other bills that we have moving forward are, for example, in the Insurance Committee, we have a bill on explanation of benefits. So the paperwork that comes through when you go and get a procedure, which is really important. But at the same time, there are certain people that may really need that paperwork not to come through to the policyholder in certain instances. So especially people under the age of 26 that remain on their parents' insurance, people who are at risk of intimate partner violence, which I know is an important category also to you in the work that you've done. And we want to make sure that if people are accessing sensitive healthcare, so that might be around reproductive health, it might be around mental health or other similar issues, that it's really important for them, for their privacy and potentially for their safety, that they be able to go and get covered for them on their insurance, but without the policyholder finding out, that there is a mechanism where those explanation of benefits can be suppressed in those circumstances. So we're working with the Insurance Committee on that.
Wonderful.
And then there's a few other bills that are on the kind of broader agenda that we're also excited about. So this Thursday, there's a whole range of hearings going on. One is on paid family and medical leave, which is obviously hugely important, that we think people, if they are parenting, if they're caregivers, should be able to access paid family and medical leave when they need to. Also on Thursday is a bill that will improve breastfeeding protections in the workplace in that same labor committee. And that will mean things like people are entitled to make sure that they have a locking private room with access to an outlet, and that maybe for things like education professionals, when they're being told that they just have to wait till the break in the day, which might be a really problematic length of time for them to wait to pump breast milk, that they will be given the right to take breaks when they really need to. So we think that's a really great bill. And then we also have a couple of bills that are about Medicaid coverage that will improve maternal health. So one is to make sure that midwives are going to be reimbursed on parity with OBGYNs when they perform the same services around childbirth. And we're hoping that that means that more people will be able to access midwife care through Medicaid in Connecticut, which would be really great for maternal health outcomes. The midwives are obviously leading on that issue. And then the other one is a bill that would mean that people would be able to start to access doulas through Medicaid. So these are people that help shepherd them through on an emotional level, on a support level, through the process of prenatal care and beyond. It's really someone that can hopefully advocate for people, especially low-income people, as they go through that process. We know that we have big problematic disparities in maternal health and maternal mortality levels for Black women in particular, and so that we're hoping that by opening up access to doulas through Medicaid, that we end up with a system where women who may be at risk of adverse maternal health outcomes, including death, have a better support system and are better able to advocate through that medical field. So it's a really broad but exciting package.
It's a very comprehensive, fantastic package. So thank you. If folks want to know more and get involved, how can they learn about NARAL?
So our website is www.prochoicect.org. If you go to that website, you can sign up to our email list. There's also somewhere you can sign up to be a volunteer if you want to get more involved in advocacy. We also help train clinic escorts for an abortion clinic in Hartford GYN Center, the last independent abortion clinic in our state. And so we always welcome people that want to get involved in that volunteer work as well.
Wonderful. Well, thank you, Sarah, for being here today. And as always, if you have questions for me, please feel free to reach out. Thank you.